Hello there. I'm Deborah from Optimal Male TRT. Today we are going to discuss the differences and benefits of subcutaneous versus intramuscular testosterone injections, and if you should prefer one over another. If you have questions about which method you should use, keep watching. The choice of injection type depends on several factors, such as the type and frequency of the medication, the patient's comfort level, and the provider's recommendation. It is important to follow the proper technique and hygiene for both types of injections to prevent complications such as pain, bruising, infection, or tissue damage. Let's talk a little more about each type. An intramuscular injection is a technique used to deliver a medication deep into the muscles. This allows the bloodstream to absorb the medication quickly. You may have received an intramuscular injection the last time you got a vaccine, like the flu shot. Some of the reasons why intramuscular injections are used are: they can deliver a larger dose of medication than subcutaneous injections because the muscle tissue can hold more volume than the subcutaneous layer. They can achieve a faster and higher peak concentration of the medication in the bloodstream, which can be desirable for some drugs, such as vaccines or hormones. They can avoid the risk of injecting the medication into the blood vessels, which can happen with subcutaneous injections if the needle is inserted too deep. Some of the common sites for intramuscular injections are the deltoid muscle of the arm, which is the site most typically used for vaccines. The vastus lateralis muscle of the thigh, which is often used for self-administration of medication. The ventrogluteal muscle of the hip, which is the safest site for adults and children older than 7 months. Some of the benefits of subcutaneous injections are: they are less painful and less likely to cause infection than IM injections, because they do not penetrate the muscle tissue. They allow for a slow and steady absorption of the medication, which can be beneficial for some drugs, such as insulin or testosterone. They are easier to administer at home, because they only require a short and thin needle and can be injected into various areas of the body, such as the abdomen, the back of the arms, or the thighs. We at Optimal Male TRT advocate for subcutaneous injections when administering testosterone, as many of our patients prefer the painless administration, ease of use, and steady release of the medication. Some of the things to always make sure of when giving subcutaneous injections are: use a new, sterile needle and syringe for each injection. Choose a different site for each injection, at least 1 inch away from the previous site. Clean the injection site with an alcohol pad and let it dry. Pinch 1 to 2 inches of skin and insert the needle at a 45 or 90-degree angle. Inject the medication slowly and gently, then remove the needle and apply gentle pressure with a gauze pad. Dispose of the used needle and syringe in a puncture-proof container. Monitor the injection site for any signs of infection, such as redness, swelling, or pain. Needle gauge sizes for both intramuscular and subcutaneous injections vary depending on the route, age, gender, weight, and injection site of the patient. Here are some general guidelines. For subcutaneous injections, a 23 to 27 gauge, 5/8 of an inch, 16 mm needle is usually used. The needle should be inserted at a 45 or 90-degree angle into the fatty tissue layer under the skin, such as the abdomen, the upper arm, or the thigh. For intramuscular injections, a 22 to 25 gauge, 1 to 1.5 inch, 25 to 38 mm needle is typically used. The needle should be inserted at a 90-degree angle into the muscle tissue, such as the deltoid muscle of the arm or the vastus lateralis muscle of the thigh. These are general recommendations and may vary depending on the type and dosage of the medication, the patient's comfort level, and the provider's advice. It is important to follow the proper technique and hygiene for both types of injections to prevent complications such as pain, bruising, infection, or tissue damage. If you have any questions or concerns about needle gauge sizes or injections, you should consult your provider. We here at Optimal Male TRT understand your issues and symptoms and would be happy to help you start on the road to vitality and restored health. If you are a Connecticut resident and would like to book a consultation with us, please contact us or visit our website at www.optimalmaletrt.com today. We look forward to seeing you.